Welcome to Conference Room. I'm Jeff Flock, and this week we want to talk about something everyone's talking about, that is healthcare, and perhaps some takeaways for business on the subject of healthcare from insurance broker C. Stephen Tucker, who is not necessarily enamored of the new healthcare law, but business has to deal with it. What is their chief concern right now?
Chief concern is the return of the excise tax. The president illegally waived it without any constitutional approval to do so. And
Explain what that is.
In other words, they have to pay a $2,000 excise tax for every full-time employee from the 30th full-time employee all the way on up. So I have clients who are facing $200,000 excise tax beginning in 2014. As soon as the president waived that, I called all of them. They were jumping for joy, you know.
Delayed
it. But it is still coming. And so they have to make preparations now for that tremendous burden on them if they don't provide Obamacare-approved health insurance.
Again, the excise tax is if they don't provide the insurance.
That's correct. And it's not just a $2,000 fine. You have to round it up or gross it up to whatever your current income tax rate is. So if your income tax rate is at 40%, that's a $2,800 fine for every single one of your full-time employees.
Well, let's play some devil's advocate here with this law, because you talk about a delay. Well, already they're delaying the employer mandate. Right. This is something that was passed by the Congress. It's been affirmed by the Supreme Court. What's the big hassle?
The big hassle is that the Chief Justice John Roberts illegally rewrote the law. The Supreme Court has a job, and that is to interpret law as it is written, and then say if it's constitutional or not constitutional. Chief Justice John Roberts literally rewrote the law from a fine for not buying health insurance and said it's a tax, and then said the government has the power to tax. So that's the problem, and now we have to deal with it. But it's only us, we the people, that have to deal with it. Business has been exempted for a year, or waived, right? The U.S. Congress has got a 75% bailout on all their health insurance premiums, again done illegally by this president. The only people left is us. And watch, after this whole debate with Obamacare defunding is over, watch a waiver go to the unions so that they too get a massive subsidy on their Cadillac health insurance.
Talking about the people, the president has said, listen, when you look at the fine print on this, the people will see that healthcare, affordable healthcare, can be had for about the cost of their cell phone bill.
Yeah.
What do you say to that?
Yes, well, here's how he's doing that. This is the average family income, according to the U.S. Census in 2012, $51,144 for a family of four. Okay? This is the cost of the cheapest health insurance plan. This is according to the Kaiser Family Institute in 2014, $11,893. Okay? We, the people, the 51% of us left paying income taxes in this country, are going to pay to the insurance company, not to them. It goes to the insurance company, $8,363. All they're going to pay is $3,529 a year. But it's going to expose them to $12,700 in out-of-pocket expenses each year. So we're paying this to the insurance company. They're paying that. They're going to think Barack Obama is the greatest thing since sliced bread because he magically reduced health insurance premiums. Meanwhile, we're on the hook for $8,363 just for this family. Now extrapolate that over millions and millions of families who will be getting these massive subsidies. This is the largest transfer of wealth from the U.S. Treasury to the health insurance industry in American history.
I've got to ask you, finally, before we get away and run out of time, cost of health care. Obviously, big costs here, and nothing in healthcare reform, it appears, is addressing those costs.
Yes.
What would we do if we wanted to address those costs?
We would repeal mandates. If you go back to 1979, there were a total of 252 federally and state-imposed mandates on health insurance companies, and all of them for medically necessary expensive. Today, post-Obamacare, we're at 2,262 mandates. Now, I know that sounds like a lot.
Mandates means covering. You have to cover this.
Right. And they're not all medically necessary. So I brought them with me. It sounds like a lot. This is what they look like when you roll them all out. This is the reason that health insurance costs so much money. If you go through here, you're looking at some of these things like health club memberships, right? Hair prosthetics. What else? Athletic trainers. Smoking cessation. There's a whole bunch of things that are not medically necessary. And this is why health insurance costs so much money. Get the government's big boot off the private sector and you will see premiums go down.
That's not something that got addressed.
That's correct. That's exactly right. It piles on more mandates. We're adding 10 essential health benefits on January 1st, and we already added 65 quote-unquote free preventative care exams. Nothing is free, so all the premiums did was rise in order to pay for a free colonoscopy, and all these other 65 tests. So nothing's free.
Wisdom on the healthcare law from C. Stephen Tucker, insurance broker. Busy now, because a lot of people need guidance on the subject of the healthcare law. Don't know about the business going forward with these health exchanges out there. May well put people like him out of business. That is your look this week inside business on the Fox Business Network.